help. All the nurses, you know, you got some nurses, you know, they gonna act the way they act. But for the most part, if you needed help, everybody was willing to help. Even other, because it was a lot of travel nurses there at the time. But even the other travel nurses, they were willing to help. And let me see what else. What kind of patients did we? You know, it's med-surg, so you get all type of patients. But we used to get a lot of insulin drips, a lot of insulin drips, a lot of heparin drips. Let's see, a lot of stroke patients, because that was one of the things that floor, like I get specialized in. So we used to get a lot of stroke patients, a lot of patients with diseases that I only, you know, learn about in the book, like those rare diseases. So I got a chance to experience stuff like that. And the nurses I work with, we used to go out to breakfast and, you know, just try to build some type of bond together. Everybody was really cool. I really enjoyed that environment. It was a good, stress-free environment. I did used to get pulled sometimes, but not that much. And then when you did get pulled, I used to always get pulled to the, I don't know, I guess the 8th floor or something. But it was kind of a floor like I worked on, another med-surg floor. But I used to always get pulled there, and the most patients I used to have up there was 5. That floor was kind of a bit, I would say, a little bit rougher than the one I worked on. What else I want to say about that hospital? Just the doctors. Yes, the doctors, because it was also it was a teacher hospital, so a lot of the residents used to deal with a lot of them. What else? The doctors were cool. They were chill. Never had a problem. Hold on, let me rewind. I did have a problem with one doctor. She got mad I gave the patient some Narcan, but the patient needed the Narcan, and I didn't care what she was talking about. So, yeah, I mean, you're going to encounter situations like that throughout nursing, but